Hi, I'm Dr. Castanet. I'm going to explain to you today in a very simple way why our approach to treatment for neck and back problems is the most effective and logical in my 27 years experience with almost 40,000 patients now. The reason is very simple. Neck and back problems generally, probably 98% of the time or more, are as a result of compression. Compression is what life does to our spines over time. That means over time, discs, which are the soft tissue between the vertebrae, they degenerate, they lose water content, they collapse slowly, and they give rise to pain. The compression could come as a result of the disc herniating or bulging and putting pressure on nerve roots. It can be that the disc degenerates and loses height over time, putting more pressure on the joints and making the holes for the nerves smaller, so there's less space for the nerves. It can be because of these degenerative changes, which are accompanied also with enlargement of the ligaments, makes less space available for the nerves as well. But in any case, these are always variations on the theme of compression. The 1 or 2% that does not involve compression as the cause of pain derives from very unusual things like tumors, cancer, infection, fracture, dislocation, and then another subset of things we will call instability. Instability is when your spine, because the bones aren't right, either an acquired or congenital defect in the bones, results in instability of your spine so that when you bend, the spine slips back and forth too much, and that can be a source of pain. But again, these entities comprise maybe 1 or 2% of back pain, and these are very often surgical. But the bulk of why we have neck and back pain is real simple. It's gravity and time. These degenerate the spine. They put more pressure on the pain generators in the spine, meaning the discs, the nerves, and the joints. This is an example of some vertebrae or bones in the low back. This is a disc in between. There's another disc above that one. Over time, this, which looks like a good disc, can lose water content just from wear and tear. Physical demands, genetics play a role, and this may lose height and water content and collapse, putting more pressure on the joints here and making the hole right here on the side smaller. Over time, it may come to look like this, where there's been disc collapse over decades. The bones then have more pressure on them. They can become swollen. They can also become deformed and arthritic like this and degenerated. All of this makes less room in the side here for the nerve roots to exit and can put pressure on the nerves. The discs may also bulge out or herniate that way, putting pressure on nerve roots that are trying to go down the canal right there. All of this, again, are varieties of compression. So how best to treat this? Well, the answer is intuitive and it's logical. And in fact, clinically, it works the best. The best treatment I've found is not adjusting joints. It's not putting electrical stim on joints. It's not having you do exercises to strengthen the muscles around the joints. It's to directly address the compressive process that's giving rise to pain in the disc, the nerve, and joints. What does that mean? Well, we use the most sophisticated table available in the world for that purpose. We lie you on a table, we secure your anatomy in the low back or the neck to the table, and then the table very gently stretches and takes pressure off of the discs, joints, and nerves in the neck or back, depending on where your problem is. This results in more space and less pressure on the discs, nerves, and joints while you're on the table, and it also initiates changes physiologically in the disc that help the disc improve and reverse some of the degenerative changes that have resulted in compression, which has resulted in pain. Very simple, very intuitive, very logical, very real, very effective. That is the best way to treat the vast majority of neck and back problems. So wherever you go for treatment, they should have an effective means of applying this method of treatment for your problem. I can tell you that's rare. These very effective tables are very rare, very expensive. I happen to have 3 here, the only 3 from this manufacturer in Georgia. There are a couple of other manufacturers that make good, effective tables also. But if you take all of these together, you'll probably find them in the Atlanta metro area at maybe 10, maybe 15 clinics. There are other methods of treatment that are valid, but not most direct and most effective for neck and back pain. Those are the things I alluded to earlier, or mentioned earlier. That means strengthening the core. Why? Because a strong core or muscles around your abdomen, when you engage those muscles, will protect you from physical demands, so that if you bend, lift, get in and out of car, in and out of bed, if you contract those muscles, it compresses the air in your abdomen and it stabilizes your spine to protect your spine. But it does nothing about the compressive cause of your pain, and that is the most direct way to treat the problem. So decompress the spine to get the pain better, strengthen the core and the spinal muscles to protect the spine in the future. They're 2 totally independent factors. Both should be addressed, but if you want to most directly address the pain, it's not exercise, it's decompressing the compressive lesion in your spine giving rise to pain in the neck or back. I'm Dr. Castanet. If we can help you, call us at Backstrong, 770-908-0740. Thanks very much.